Every year, tobacco kills 1 million people in India. For adult men, smoking is responsible for 1 in 5 deaths. The majority of these deaths are driven by a specific product, the bidi. These are slim, hand-rolled cigarettes wrapped in tendu leaves. Despite the mortality rate, bidis remain almost entirely untaxed at the central level. Formal cigarettes face a tax rate hovering around 40% of the retail price. That 40% sits well below the benchmark set by the World Bank and the World Health Organization, which recommend a 65 to 80% tax rate for effective tobacco control. Policymakers have kept these rates stagnant because of a persistent economic fear that significantly raising tobacco taxes would inflict severe financial harm on the country's poorest citizens. This concern is rooted in the concept of a regressive tax. This is a consumption tax that extracts a higher percentage of income from low earners than it does from those with high incomes. This creates a policy deadlock. Lawmakers assume that implementing a proven public health measure would be an act of economic warfare against their most vulnerable constituents. Here is how that regressive mechanic works. A flat tax makes a $10 a day earner feel the cost much more acutely than a $100 a day earner. But this model assumes uniform price responsiveness across all income brackets. Uniform behavior implies that if the price of tobacco doubles, a wealthy smoker and a low-income smoker will both continue buying this same amount, simply absorbing the new cost. A working paper from Emmanuel Guidon, Arindam Nandi, Frank Chalupka, and Prabhat Jha puts this specific assumption to a rigorous test in the Indian context. They analyzed consecutive rounds of the National Sample Survey, tracking the consumption data of over 470,000 households. They isolated a metric called own price elasticity, which measures exactly how much demand for a product changes when its price rises. They wanted to see if the poor actually react to price hikes the same way the wealthy do. If the survey data proves elasticity is not uniform across socioeconomic lines, the economic argument against raising tobacco taxes fails. Calculating price elasticity across 1.2 billion people is a logistical hurdle. In developing economies with large informal markets, standard retail prices rarely exist for products like bidis. To solve this, the researchers used unit values. This is derived by taking the total amount a household spent on an item and dividing it by the quantity they consumed. However, this approach has a flaw. Unit values accidentally conflate actual market prices with quality choice. If a wealthy household buys a small number of expensive premium cigarettes, their calculated unit value appears artificially high. The survey data confirms this bias. As total household expenditure rises, the unit value paid for cigarettes increases by up to 20%, purely because households are choosing premium brands. To correct this error, the study applied a methodology developed by economist Angus Deaton, his two-equation system of budget shares and unit values. Deaton's system mathematically strips the effects of quality choice out of the household budget data. It does this by grouping households into precise geographical clusters, like specific villages or urban blocks. Within a single cluster, the system assumes market prices are uniform, allowing researchers to isolate variations caused by true price responsiveness. By purging the quality bias from hundreds of thousands of survey responses, the researchers calculated the true, unskewed price elasticity of the Indian tobacco consumer. This chart shows the global consensus on tobacco price elasticity in high-income countries. It holds steady at roughly -0.4. But the corrected data for India reveals a completely different consumer profile. The own price elasticity for bidis ranges from -0.6 down to -0.95. The elasticity for formal cigarettes approaches -1.0. In economic terms, an elasticity of -1 means that a 10% increase in the price of cigarettes results in a nearly 10% reduction in total demand. This metric is substantially larger than previous literature suggested. It shows that formal cigarette users in India are highly responsive to price changes. On average, Indian consumers are roughly twice as sensitive to tobacco price shocks as consumers in Western economies. Establishing high baseline elasticity is only the first step. To test the regressive tax theory, we have to break this data apart by socioeconomic status. This chart plots the elasticity metrics from the study's pooled analyses. We see a geographic split. Rural households exhibit a higher cigarette elasticity of negative 1.026 compared to negative 0.963 for urban households. The split remains when sorting by social groups. Households from lower caste and scheduled tribe demographics show a sharp negative 1.011 elasticity compared to negative 0.895 for other groups. When sorted by raw income, households in the lowest 3 quintiles consistently demonstrate significantly higher sensitivity to price hikes for both bidis and cigarettes compared to the top earners. Across every metric, the data reveals an undeniable socioeconomic gradient. The poorest populations are the most likely to reduce or stop purchasing tobacco when the price goes up. This proves the uniform behavior assumption false. Because low-income households drastically cut their consumption in response to price hikes, they are effectively exempt from the linear financial punishment of a consumption tax. Consider what happens if lawmakers introduce a hypothetical aggressive tax shock across the entire Indian tobacco market. This dual-axis graph tracks the demographic response. For high-income earners, their relative inelasticity means their tobacco consumption drops only slightly. They continue buying the product and simply absorb the higher monetary tax burden. But for the lowest earners, their near negative 1.0 elasticity forces a different reaction. Their consumption line plummets. Because they stop buying, the actual financial tax they pay remains incredibly small. By abandoning tobacco, these low-income households gain a secondary economic benefit. They avoid the costs of treating smoking-attributable diseases. Currently, those medical expenses cost the Indian population over $900 million annually, frequently forcing families into poverty through distressed selling of assets to cover hospital bills. In a high-elasticity environment, a tax shock does not punish the poor. It charges the wealthy in cash while charging the poor in behavioral change, triggering a significant health benefit for the most vulnerable groups. This leaves one final political concern. If the largest demographic stops buying tobacco, won't state revenues collapse? No, because the current tax baseline is so low, nearly zero on bidis and roughly 40% on cigarettes, even substantial relative tax hikes will not outpace the remaining demand from the inelastic, wealthy class. The mathematical reality is that doubling the current tax rate would result in a net increase in government tax revenue. Implementing the World Bank's recommended 65 to 80% tax rate creates a dual-win scenario. It achieves a sharp reduction in mortality while generating capital for the state. By using Deaton's methodology to correct the unit value data, economists proved the uniformity assumption to be entirely false. Raising tobacco taxes in developing economies does not inflict an economic penalty on the poor. It is an empirically